Telephone communication is probably the most important aspect of the medical practice. All telephone systems are different. Ensure that you know how to put people on hold and transfer telephone calls to the treatment room, GPs, or another department within your practice. Some patients may telephone distressed, be unsure, have children screaming in the background, or be in a noisy environment. Make sure you understand everything that the patient says. When answering the telephone, make sure you say your name and the name of the practice clearly. For instance, "Good afternoon, this is Main Street Medical Practice, Diane speaking. Can I help you?" If you are extremely busy, which you probably will be on a Monday morning, and you need to put the patient on hold, make sure you ask the patient whether it is a clinical emergency before you put them on hold. For instance, "Good morning, this is Main Street Medical Practice, Diane speaking. Is this a medical emergency? Could I put you on hold?" Make sure the patient replies before you put them on hold. The patient could be having cardiac issues, or there could be a medical emergency in the background. Make sure you have a clear understanding what the patient has said before you put them on hold. Make sure you have checked with your practice manager and the GP on the policy of returning telephone calls. Some patients may wish to speak to a GP. For instance, if the patient is phoning up and they have not seen the GP for 6 months and they require a prescription, the GP may not want to take that telephone call. The GP may not want to give out a prescription before seeing the patient. Make sure you have a clear understanding from the GP and the practice manager on how you handle these telephone calls. Some telephone calls may also be able to be put through to the practice nurse, for instance, if they need some kind of result. Again, make sure you check with your supervisor. Check with your practice manager and the GP on the procedure for putting telephone calls through whilst the GP is consulting. For instance, a GP could be in a procedure and be unable to answer the telephone. Or, a GP may be consulting with a patient who has a mental illness and finds the telephone call disturbing to the consultation. Try to think of yourself in the situation where you are a patient or you are a GP and you're receiving a lot of incoming telephone calls. You may also get some patients who telephone and say that the situation is urgent. It is really important that you find out what the patient determines as urgent. For instance, an urgent situation would not be a patient who telephones to say their car is broken down and they cannot make their appointment. An urgent situation usually is a clinical situation. When you take a message from a patient, make sure that you take the date, time, patient's name, date of birth, and exactly what the patient says on the telephone. Once you have taken this information, repeat the information back to the patient before you send it on to the GP or the practice manager. Most importantly, make sure you follow through on the message. For instance, if you have an email messaging system, you may have to make sure that the GP has read the email and that it has been followed up with the patient. Nearly all appointments in general practices are now taken through an electronic appointment system. This could be Praxsoft, Best Practice, or Practix, or any other software that is available to medical practices. When making the appointment, listen to the patient's needs carefully. For instance, are they just booking one appointment or do they want a longer appointment? Do they have one specific issue or do they have several issues? Some patients may say they want a 15-minute appointment or specify that they want a normal appointment. But after listening to them on the telephone, you might determine that the patient actually needs a longer appointment of 20 minutes. A patient may also be phoning for a procedure or a healthcare assessment. Again, these appointments require longer times. Sometimes, if a patient is phoning for a procedure, the patient may need to be booked in with the nurse and the GP. Find out from the practice nurse, the GP, or the practice manager what is the process for booking a patient in for a procedure. Most of the time, when young mums telephone and need their children vaccinated, the patient will need to be booked in with the nurse for the first 10 minutes and then with the GP. In some software products, there are icons which you can link to each appointment. For instance, if a patient is coming in for a pap smear or a procedure, you can right-click on the appointment and choose the icon which is appropriate to that appointment. Sometimes the GP will ask you to make an appointment for a patient for a recall. Sometimes these recalls are really important. For instance, a patient may be required to come back to see a GP for urgent pathology results. Make sure you know what the practice icon is to link with that appointment. For instance, in some practices, if you see a cross next to the appointment, that means the patient is not allowed to cancel the appointment without seeing the GP. Some patients may telephone and require a home visit or an after-hours visit. Again, check with the GP who looks after the patient or check with the practice manager to find out what the policy and procedure is for making these appointments. Most general practices now have a locum service that looks after their after-hours needs. Make sure you know who the after-hours locum service is for your practice. There should be brochures or posters around the medical practice with the telephone number and the name of the agency that provides this service. This information can also be given out by an information sheet that should be supplied by the medical practice. When booking in new patients, make sure you have all the details of the new patient. Usually, the minimum requirements are patient's full name, telephone number, date of birth. Make sure you give the patient all the information about the medical practice. For instance, which GP they are seeing, where the practice is located, to come to the practice 10 minutes prior to the consultation to fill out any forms. Are the forms available on the practice website so the patient can fill out the forms prior to coming into the medical practice? Have you told the patient how much the consultation fee will be? Have you explained to the patient that the patient can pay by EFTPOS, credit card, or cash? Have you explained to the patient the accounts policy, i.e., most practices now do not take accounts. The patient is expected to pay on the day. You will probably have a Tyro system or an EFTPOS system, which allows the patient to claim the Medicare rebate at the medical practice. Explain the policies and the procedures to the patient so that they can know to claim the Medicare rebate when they are at the practice. This can be done by easy claims through your software or online claiming.